So I'm going to speak to you about the negative impact of air pollution on respiratory health. As Sharon said, I'm a consultant respiratory physician in CUH. And before we kind of get into the different diseases, just on a philosophical note, the reason the lung is important is that if you think of all of the solid organs that we have, brain, liver, kidneys, heart, etc., the lung is really the only one that's in direct contact with the external environment. And it's in direct contact with the external environment every time you take a breath. So it's uniquely susceptible to damage from all these external airborne assaults, essentially, the noxious particles that the guys were talking about, bacteria, viruses, etc., spores. And there's a huge diversity of potential insults to the airway every time we take a breath. I know this is sponsored by the Asthma Society, but I think it's important to also mention another airways disease, COPD, or chronic obstructive pulmonary disease. And this is a disease that's characterized by completely reversible progressive airflow obstruction, and it's associated with inflammation in the lungs. It's caused by prolonged exposure to generally tobacco smoke, but also other noxious particles and gases. And the term COPD is an umbrella term for two conditions, really: chronic bronchitis and emphysema. So what happens is you have a susceptible patient who either smokes or is exposed to occupational dust and chemicals, passive cigarette smoke, or either indoor and outdoor air pollution. And that, in interplay with their genetic predisposition, results in the condition COPD. So essentially you get inflammation within the airways, and that causes parenchymal destruction. People don't have as much surface area for gas exchange, they get airway trapping, and become short of breath, and ultimately they run into problems. There's about 110,000 people diagnosed with COPD in Ireland, and a further potentially 300,000 people who are potentially undiagnosed. So this is a huge problem. In Ireland, COPD accounts for 22% of total respiratory mortality. There's 13,000 admissions with a primary diagnosis of COPD in Ireland each year. Asthma, which is our other huge respiratory condition in this country, it's a chronic inflammatory disorder of the airways. It's associated with airway hyperresponsiveness or twitchiness, leading to recurrent episodes of wheeze, breathlessness and cough in response to an array of stimuli. And this variable obstruction within the airway is generally reversible either spontaneously or with treatment. And that's the major difference with COPD. COPD, it tends not to be completely reversible. It's a serious global health problem. There's approximately 300 million asthmatics worldwide. And this is a startling statistic, I think. The prevalence of asthma is increasing. And in the Western world, it's increased by 50% every decade for the last 40 years. Ireland has the fourth highest prevalence of asthma in the world. There's approximately almost 500,000 people affected. And suboptimal asthma control is associated with significant limitation of activities of daily living and is potentially fatal. There's about 80 deaths a year from asthma in Ireland. GINA, or the Global Initiative for Asthma, is kind of the Bible that clinicians use, and a lot of the patient groups will use as well. And I'm glad to say that the initial chair of this was an Irishman, a fellow called Paul O'Byrne, who's based in McMaster, who I worked for, as did Terry O'Connor, who's one of the other respiratory physicians in this country. And the current chair is also an Irishman, a fellow called Mark Fitzgerald, who's also based in asthma, or in Canada. And the clinical manifestations of asthma are generally well controlled with appropriate therapy. It's important to state that. And with improved overall asthma control, there's an improved observed reduction in exacerbations, or the current modern term is attacks, in terms of both frequency and severity. There's a whole host of triggers for asthma attacks or exacerbations. And a lot of these will have been alluded to earlier on. So allergens, solvents, sinusitis or rhinitis, sulfur dioxide, ozone, nitrogen dioxide, particulate matter, traffic-related pollution, occupation, cigarette smoke, either actively or passively, airway pollution, weather changes, exercise, infections, medications, reflux, and even stress. And when we're seeing patients, we ask them to take general measures to try and reduce exposure to some categories of risk factors which can improve the control of asthma and reduce the need for medication. And these include reducing exposure to indoor allergens, particularly house dust mite, dogs, cats. If they're in around the home, we ask them to get them out. Avoid tobacco smoke, avoid vehicle admissions if possible, identify irritants in the workplace, which can be very problematic, and also, if possible, to reduce exposure to air pollution. On the 29th of March 2004, the Irish government introduced the world's first national ban on workplace smoking. The Public Health Act in 2002 and the Public Health or Tobacco Amendment Act in 2004 prohibit smoking in indoor workplaces, including bars and restaurants, to reduce the risks to workers' health. So, while we're not great at certain parts of it, Ireland has taken the lead on other parts of lung health, and I think our government in some ways is to be commended for this. And this was rightly lauded in the medical literature. It got an editorial that week in The Lancet, and it got a further editorial in the New England Journal of Medicine, which are the two Bibles for medics worldwide. We alluded to some of Luke Clancy's work in the earlier talks, and this was a follow-up study after the smoking ban published in the Blue Journal, the American Journal of Respiratory and Critical Care Medicine in 2007. And what it showed essentially is following the workplace smoking ban, they looked at 42 pubs, and they found there was reduced particulate matter and benzene in the pubs. There was reduced exhaled carbon monoxide and salivary coatatine in barmen, which is a marker of nicotine exposure. There was improved health in non-smoking bar staff. There was improved irritant symptoms in smoking bar staff. And overall, there was also a change in attitude of smokers. The majority of smokers were actually in favour of the ban when they were surveyed at that time. Again, we mentioned this study earlier on. Again, Luke Clancy was the lead author in this, and this was published in The Lancet in 2002. And what they showed was that since the Dublin smoky coal ban in 1990, there has been an estimated 359 lives saved per year, 116 from respiratory causes and 243 from cardiovascular causes. This is taken from an excellent review of air pollution and asthma published in The Lancet last year. And it was alluded to earlier on. But what I would like as a clinician, but it's not available at the moment, is to be able to say to patients, look, we have real-time monitoring available of particulate matter and air pollution. And if it's low, you should go out and enjoy yourself. If it's moderate, if you have lung problems, take care. If it's high, you should try and stay indoors. And if it's very high, again, you need to be careful, and you might find that you need to use your reliever inhalers a bit more. And this would be extremely useful to patients. So what we're calling for is there should be a real-time system of monitoring air quality and pollution in this country. There is in parts of it, but there should definitely be in Cork. This would allow patients with respiratory conditions to tailor their activities accordingly, with resultant health and economic benefits to both the individuals and also to society. Thank you.